Welcome to Coffee with Paul, where your city manager talks about topics that are important to you.
All right, well, welcome back to another segment with Coffee with Paul. Today with me we have Daniel Scholl, who's the Vice President for the Division of Research and Economic Development at SDSU. Here between the city and SDSU, we communicate quite frequently now more than ever because of things that are going on in our community with COVID. Citizens should know that between Daniel, the president, the mayor, city council members, and other professionals throughout the community, we're constantly communicating to understand how we can react to COVID to protect not only the citizens, our businesses, but just as importantly, SDSU, what we can do to help them and our students, our residents of our community. Daniel, welcome to another Coffee with Paul.
Thank you, Paul. It's a pleasure to be here. I appreciate our partnership throughout, and being able to talk together is just one more step in that.
Wonderful. Well, we'll just get right into it. You know, we've had a lot of questions about COVID-19 testing and the reporting there at the university from community members. Can you help me provide some clarity on how testing and SDSU positive COVID-19 cases are being reported out there to the public?
Sure, Paul. First, let me say that the testing that we've stood up and are developing here on campus for our students is really in parallel to the testing that has been in place for quite some time within the community through our healthcare providers, our health systems. And so we follow a similar pattern where the testing data falls under medical privacy issues, and it is under the purview of the Department of Health because this is a public health emergency. And so we report our data first and foremost to each individual patient who's tested directly to the Department of Health. And then that data is presented back to the public in aggregate form in the same means, with the exception that we have a dashboard at SDSU for active cases among students, among employees, and quarantine students and employees. And so you'll really see very quickly, you'll see the effects of our testing, our in-house testing results on those dashboards.
Wonderful, Daniel. Can you point out where the public could go to find out where that dashboard is? Because I know it's updated daily, if not quite consistently. And I'm sure our media folks will put this up on the video as we speak.
You bet. So go to sdstate.edu, our internet landing page, and right up there, easy to find and click, is JacksRBack. And there are three links at the top of the JacksRBack page. And one of those three links is the SDSU COVID-19 dashboard. And it's updated approximately by midday, every workday of the week.
Daniel, can you help us understand the difference between the Department of Health numbers and the SDSU numbers? Because I know there's some nuances there between the two.
Sure. So the Department of Health numbers are derived from the test result data that is by law transmitted within a specific period of time to the Department of Health. And they use that to report back out. So they collate that data and report it back out in the county by county data that we're accustomed to looking at. They also use that data to investigate contacts of confirmed infections and confirmed cases of COVID-19. The SDSU data, the SDSU dashboard, is based on our own internal information. And so that's information that will have come to us from or be influenced by Department of Health, but mostly it's internally self-identified data. So if someone is sick, they have a test positive, they contact the university and declare that. Or if they're potentially a close contact of someone who has a laboratory confirmed case of COVID-19, then that's declared internally as well. And those numbers are assembled and presented on the dashboard.
Now, Daniel, I've heard you talk about here recently the number of testing that we could do or that the university can do on campus. Can you talk about some of those numbers and what type of tests you have available there?
Right. So we have two types of tests. One is called a clinical point of care test, where we can rapidly perform a test on an individual who is sick. and has symptoms that may be indicative of COVID-19 disease. And we can test for the actual presence of the SARS-2 virus that causes COVID-19. And we can do a few of those, several of those per hour, but we can't do hundreds of those. And of course, we have more than hundreds of students here at SDSU. So we have established within our Animal Disease Research and Diagnostic Laboratory a One Health diagnostic laboratory that is federally certified to test large numbers of people at one time for SARS-2 infection. So we can do, very readily, we can do about 200 per day or 1,000 per normal work week. And that's important for us to be able to do that, to work in partnership with the Brookings community, where there are another 20,000+ people. And so we're working in tandem with one another to provide actionable information so people can take the steps to recover and protect others from possible sources of infection that they might represent.
Sure. Thank you, Daniel. One of the questions that I get a lot is, what is the city's plans? What are the university's plans? I know the city, for people that are interested, could go to our COVID webpage, find the different phases that we have, the various metrics of which SDSU, Bonnie Specker, and as well as other professionals of the community has helped us out with. It's a great resource to have SDSU in our backyard. But what are the phases, or where can people find more information about the plans SDSU has?
Again, the JacksRBack link on the SD State webpage has all of that information. There's quite a bit of information there, and so one has to investigate a bit. And we're continually updating it as the messaging becomes denser and denser. We try to improve the organization to make it easier to navigate. But you can see our 4 phases, and we're currently in phase orange right now, not the exact same colors as the city, but the phases are pretty recognizable from their descriptions.
Thank you. Just so the public who are watching here knows, we've gotten a lot of comments that the university is back. That's why we're seeing the spike in numbers. The reality is, in talking to our local healthcare professionals, that it's just as much our local community beyond just our students that are returning back to the community of Brookings. So just want to throw it out there that we all have to do our part. The university is requiring a mask mandate indoors. The city as a general, we need to do our part to help curb this and mitigate the increase in COVID as much as possible. The schools are also doing their part. It's another partner that we have within our community. And so the public knows not only does the city, the school system, SDSU, and all of our community partners work together in tandem to try to protect our local community and resources as much as possible. Anything you'd like to share before we end this segment with Coffee with Paul, Daniel?
Well, I really appreciate the opportunity to visit together, and especially the opportunity to partner on our approaches to protecting all of us. If we weren't able to partner, it'd be so disjointed, and I don't think that we'd succeed. So thank you for the partnership.
I agree wholeheartedly. Thank you all for watching Coffee with Paul, and hopefully we can have another segment before too long. Make sure you're submitting those questions so we can provide more clear answers to the questions that are going on throughout our community. Once again, thank you, Daniel, for joining us with this segment of Coffee with Paul.
You're welcome. It's a pleasure, Paul.
Earlier this week, we met with Daniel Scholl, who gave us a brief update of the SDSU numbers and their latest testing protocols, including their dashboard that they now have available to the public so you can see what the numbers look like for COVID cases, not only with the faculty, but also the students. Today, I'd like to talk a little bit about the new mandate for masks here in Brookings that was just passed earlier this week. People should know that the mandate does affect people only indoors of businesses and indoors in public places. Now, it only requires a mask if you are within 6 feet or less of anyone in those areas. So once again, if you're beyond 6 feet, you do not have to wear a mask. But if you are within 6 feet, it is now mandated that you have to wear a mask in any indoor business or public place. So there are a number of different exceptions noted within the resolution and ordinance that was currently passed this last week. Those include exceptions for medical reasons, exceptions for people who are eating or drinking in establishments. And how that works is simply as a patron, you go into a business with your mask on, you order with your mask on, you're able to take that mask off when you decide to eat or drink and then put the mask back on. There are other exceptions for places of worship, schools, universities, and other places
that generally have a COVID protocol already in place. So the only time that an outdoor event is required or outdoor activities are required to have masks is at any permitted city event. So that includes any parades, any 5Ks, or things in which we close the streets for a certain event. Those individuals that can't practice social distance will be required to wear a mask. But those individuals that can, such as in a 5K run, they are not required to wear a mask. So a couple questions that we have been getting lately is, does a business have to regulate the mask ordinance? And that is not the case, nor should individuals that are wearing masks, or any individual for that sake. If someone sees individuals not wearing masks that are within 5 or 6 feet or less, and within indoor businesses or public places, we encourage them to contact the non-emergency number of the police department. So a lot of people have been asking questions about school sanctioned events. Brookings Public Schools does have a more restrictive COVID plan that governs their students and activities outside of school that are related to the school athletics. Therefore, the city has chosen to leave the schools out of the ordinance, knowing that they have a COVID plan currently in place.
Yeah.
So a lot of people have asked, what's the goal of the mask mandate? The goal of the mask mandate, the purpose why the mask mandate was implemented, was to try to reduce the increased cases of COVID. Here over the last 2 weeks, we've seen a substantial increase in the number of cases, the increase of positivity, and the metrics in which we look at to judge whether or not we have to move through thresholds were all triggered with the exception of one. Therefore, prior to jumping to phase 2, which would shut down businesses, it was staff's intent, and I believe the council's intent, to impact the reduction of COVID cases with the implementation of a mask mandate. We hope to see positive results from this action within the next 7, 14, or 21 days. Over the last few weeks within the city of Brookings, we've had a lot of discussions on the mask mandate. Now that council has officially passed the resolution and the ordinance, city staff will be working very diligently with our community partners to ensure that the frequently asked questions are submitted to the public and to businesses so that people can get questions answered. Anyone interested in finding out more information about our phases, the mask mandate, our current thresholds, encourage them to go out to our website and find out more information and ask those questions to Coffee with Paul or to our general Engage Brookings app.